everyone. Thank you for joining us again today. This is Rebecca Schaefer at Cincinnati Children's Hospital, and I'm here today with Dr. Ernie Petapati, who's going to talk with us about how to have telemedicine appointments and some tips and tricks for doing it. So we're going to talk about medication appointments as well as some tricks for behavioral therapy appointments.
Thanks a lot, Rebecca. You know, this is the closest that I'll ever get to being a YouTube star. So, and during this period of social distancing, I've probably had more telemedicine visits in the last month than in my entire career. I've honestly been surprised at how useful the technology has been for connecting families. In general, you should consider a telemedicine visit nearly identical to an in-person visit. Most follow-up visits will last between 15 to 30 minutes. Other than using any special equipment, most doctors have ways of examining patients through videos. There are no limitations on what medication or treatment we can prescribe during these visits. The visit's also private. No recordings or sharing of the video feed will occur without your express permission. Finally, most telemedicine visits are billed similarly to an in-person visit by most offices. I think it's helpful to talk about a few things to have at the ready to make the visit as easy and practical as possible. It's always good to work out any computer, phone, or tablet issues by making a test call to a friend or someone else in the house before the appointment. Most offices will have an application that can both interface with a computer, tablet, or phone. Don't worry, glitches happen, and they happen often. Many visits, my visits, have been temporarily disconnected, or I've had AV difficulties. We'll try to reconnect with you as soon as possible, and if not, we'll call you by telephone. If you have some limitations, such as data caps or slow internet, feel free to tell the doctor ahead of time. We can quickly perform the examination and then switch over to a phone conversation to improve the quality of the conversation. Measurements. Usually getting a child's height and weight is a very important part of what we do in the office. If you can estimate those measurements prior to the visit, we'll make good use of it. These measures help us track side effects of certain medications and also help us track your child's development. Let's talk about medications. I think it's always really helpful to have the physical bottles of medication out during the appointment. There's a surprising amount of information on those bottles that save time for conversation. Having a record of the times you give the medication and any other medications like supplements can give us great context. There are many times that just changing the timing of a medication can decrease its side effects or make it more effective. One thing I always bring up with families is having out a sheet of paper. It's simple and practical. We are so used to printing out sheets in the office with instructions and other information that sometimes at the end of the visit, we want to give you some information right away, but aren't really able to do this. Some systems have automated ways of being able to mail out or fax or email out the instructions, but some sites, it's better to get the information firsthand from your doctor right away. I've noticed that it's super helpful to have the sheet of paper and to ask specifically, are there any particular instructions that you want us to follow immediately after the appointment? You can also set up a follow-up visit with date and time, as most providers do have their schedule available with them. There are some differences between an in-person visit and a telemedicine visit. I think in many ways an in-person visit will always have the advantage, especially because there is so much nonverbal information that you can share. But there are a few things to help us bridge the gap. You don't have to have the visit on a tabletop. We are flexible, especially with children. Feel free to pick out a spot that will give you a good opportunity to both supervise and allow the child to be comfortable and occupied, such as a playroom or during a favorite television show, especially if there are no other caretakers around. Short of being in a moving vehicle and protecting your privacy, be creative. I think it's worthwhile to tell us about your child's routine, such as their mornings, what they're doing for programming, and their bedtimes. Also, give us a sense of the child's demands. If things are more or less, we'll be able to help adjust medications appropriately, especially if there have been some big changes. I think when it comes to context, bringing up your concerns and framing it in a larger picture can be really helpful on these visits. By putting a bad week in the context of the last 6 months, we can have a better sense on how aggressive to be regarding our treatment planning. Let me briefly discuss symptoms. I usually talk about the 3 A's when discussing common symptoms that parents and doctors should talk about. These are affect, aggression, and attention. So there are many other psychiatric concerns, but I find that these 3 probably encompass about 90% of the most important concerns and conditions we can treat effectively. Affect really represents a child's mood. This may include things like depression or anxiety, or even excessive silliness. Aggression may include both self-injury and physical aggression to others. Attention involves impulsivity, organization and planning of activities, and hyperactivity. There are also a few symptoms I call red flag symptoms. This may be things like severe aggression or suicidality or unusual thoughts or behavior. Sometimes we call this psychosis. It is always important to raise these issues with your doctor to be addressed. Let's talk briefly about side effect conversations. Many psychiatric medications tend to have side effects that fall into 3 categories: metabolism, movements, or sleep disorders. When I talk about metabolism, I talk about gaining or losing weight, and this can be a very common side effect of many medications. The other thing is that we tend to have very effective treatments for this particular side effect. If weight gain is an issue, having a recent weight can help us track this change. Movements with different types of medication may include tremors or tics. Even over a video call, it is not uncommon for doctors to be able to recognize these common movements. Finally, sleep or sedation is a common psychiatric condition, but it is also a very common side effect. It's worth discussing after starting a particular medication or changing the dose. There might be an increase in sleep or a decrease in sleep. Even with all the anxiety out there, there is a silver lining. One mother told me that she did not realize how fast her world had become until it had to slow down. There's something very special about being able to perform these visits in your home. Especially for us with children, we know just how difficult it is to bring a child to a doctor's appointment. And many times, your child in the doctor's office isn't the same as he is at school or at home. So most importantly, please realize that your doctor wants to see and interact with your child or patient as much as possible. Some children who I have done visits with have enjoyed interacting over the video with me at times more than in person. If it's an early appointment, we don't mind seeing your child sleeping or eating breakfast, as part of our duty to you is to examine the patient we are involved in treating. There are also so many unique things that you cannot do in an in-person appointment. More recently, I have been asking families, with their permission, if a child can share a favorite toy or a wall hanging of something they are proud of. It is not uncommon for parents to show us how siblings interact, or to have us meet other caregivers who have never been able to come to an appointment. I hope these tips have been helpful and informative for your next telemedicine visit. Today, most every doctor will have some sort of telemedicine system available. If a telemedicine visit is maybe something that is more helpful in a certain circumstance, I would not hesitate to call the office and see if that would be a possibility. There's certainly an important role for in-person visits, but it is becoming clearer and clearer that telemedicine can be a very important and flexible way to deliver care directly to where you may need it the most. Thank you very much.
All right, so just like Ernie shared for the medication visits, we're also doing telehealth visits for behavior therapy. So most psychologists and social workers who see Fragile X are likely doing some telehealth appointments to address behavior. I'm going to share some quick tips and tricks for doing this and give you a checklist of things to think about as you're setting up these visits. So give me just a second to get my slide up. All right. So as Dr. Pedapati said, most insurance companies are covering telehealth right now. You want to confirm with your provider before you set it up, but likely it is covered. You also want to confirm with your provider if it will be video or phone call. Both are available right now during this time of social distancing, but going forward, you'll want to confirm which of those is happening. You want to prepare questions ahead of time to discuss for a behavior therapy appointment. This is really important because we want to maximize the amount of time on the call and make sure that we're addressing your concerns. Sometimes when we get on video, we start to get a little distracted and maybe forget the questions that you wanted to ask. So make sure you write those down to remind yourself. You also, for most telehealth visits, as Dr. Pedapati said, you can use a computer, tablet, or phone. There's no limitations in terms of that technology. And if there are issues, we will be able to talk to you on the phone. If you receive a link to go to for the telehealth visit, you want to review those directions ahead of time and test it before the visit. You also want to make sure that you confirm whether you need Wi-Fi to complete the visit. Some of these telehealth applications are going to eat up a lot of your data on your phone if you're not using Wi-Fi. So confirm that beforehand. Plan to be at home or another residence. So it's very difficult to ensure privacy if you're in a car or you're out at the store or something along those lines. So we need you to be at home or another residence to do this visit. Try to reduce noise around you if at all possible. You know, we understand you're at home and you probably have other children who are being noisy or enjoying life during the visit. So we don't expect it to be silent, but we do want to be able to hear you. So try to make sure that we're able to at least hear you. Make sure your child is present. So as Dr. Pedapati said, physicians are going to need to examine your child for the visit just through the video. On the behavior side of things, we are able to see you without your child, but we like to see your children. We like to see how they're doing and if they're struggling in any way. But you can also confirm whether or not your child needs to be present for the whole visit. They may not need to be. So we might just need to see them initially, check in with them, and then they can go play with their toys and we can talk more in depth with you. At the end of the visit, ask the provider if they can send you a summary of the visit. This may or may not be possible, so definitely make sure you're taking some notes during it, but if it is possible, it's nice to receive a summary. The other thing I quickly wanted to touch on is that we're not currently doing any assessment in terms of doing testing for cognitive abilities or autism or other learning difficulties during this time of social distancing. And part of the reason is we really, in order for those tests to be valid, we need you to be present with us and to be able to see your child in the room. So keep that in mind. If you were hoping to get a cognitive assessment or an autism diagnosis, we may have to put that on hold for right now, but we can still address behavior. We can address any daily living skills that are happening. This is a great time to teach your kids some new skills, so we can help you do that through telehealth visits. So keep those things in mind. Think about what you want to work on for behavior visits, and then feel free to contact your provider and try to set up a visit. So that's all we have for you today. Thank you so much for joining us and talking about telehealth. Remember, you can leave questions at the bottom, and Jane will get back to you. If she doesn't have the answers, she'll let us know, and we'll get back to you with answers as well. And there is also a happy hour on Friday of this week that will answer direct questions as well by some Fragile X providers. Thanks again for your time. Hope you're all doing well.